Hello everyone, my name is Kirsten Tingle, and today I will be talking about an injury of the anterior cruciate ligament in tennis. So the objectives of this video are to discuss the anterior cruciate ligament, what it is, where it is, and what it does, as well as discuss the mechanism of an ACL, or anterior cruciate ligament, injury. We're also going to discuss the rehabilitation specifically tailored towards a tennis athlete, whereas if you are working with another patient who just needed to regain range of motion for activities of daily living, the rehabilitation would be a little bit different. So, we'll begin with locating the anterior cruciate ligament, which I will be referring to as the ACL for the remainder of the video. And this connects the femur to the tibia, and it connects the outer femur to the inner tibia. And its job as a ligament is to prevent extraneous movement in this case, the medial direction from valgus or lateral forces. So to begin to get into the discussion about an injury of the ACL, I thought it'd be helpful to watch a video of a young lady who is tearing her ACL in a competition. And you can see her left foot plant and her knee keeps driving in and then she is down. What we've just seen is a force from the outside or valgus lateral side that continued as she planted that foot, which meant that there was a rotational force, as you can see down on the left side, where her low leg had been planted and her upper leg continued, which caused this rotation that tore her ACL. And you can see in the bottom right-hand corner what a normal ACL looks like and what a torn ACL would look like. So what we're about to go into next is the treatment for tearing an ACL. And most people will undergo a surgery, though it's not necessarily required. Well, they will go into the joint, they will take out the old ACL, and they will take a part of the hamstring tendon and run it through a hole they've drilled through the tibia and the femur and angle it the same way that an ACL would be like angled. And they will use grappling hooks and screws to hold it in place, and then they will stabilize the knee, and it will remain this way until you begin post-surgery treatment, which begins with medication to ease the pain because, of course, it's going to be painful after surgery. It includes scar tissue massages, where you reduce scar tissue buildup and prevent it so that you can establish your full range of motion once again. And right after surgery, people will go into rehabilitation and physical therapy. And that's where we start here. So it is important to remember that every person is different, so no two therapy plans are going to be exactly the same way in implementation. However, the goals of all of the therapies are to stabilize the knee, regain that quad strength, continue to work on full range of motion, returning to a normal gait, and returning to play, especially for our athletes. So rehabilitation of an ACL is divided into 6 phases. The first begins right out of surgery. So we're going to start with heel props, quad sets, ankle pumps, hamstring sets, and patellar mobilizations. The goal of all these exercises is to regain range of motion and reactivate those muscles after surgery. So give me just a minute to hunch around this video a little, and I will have an athlete show you how to do these exercises. So you can see this athlete has his heel propped up on a foam roller. You can also use a bolster. And he is allowing his knee to fall into as full extension as he can. This isn't meant to push your knee into that extension, but it is meant to passively allow that joint to relax and extend the leg. The next exercise is a quad set, and you'll see our athlete is going to contract his quadricep muscles and force his knee into the table, which again works on extension while also reestablishing those muscles in the quad and reconnecting them to the brain. The next is an ankle pump, and you'll see the athlete will push his toes down like he's pushing on a gas pedal, and then pull his toes back towards his face, all while keeping his leg locked out. This strengthens calf and helps to contribute to overall leg strength to restabilize that knee. The next exercise listed is a hamstring set, very similar to a quad set, except in this case, we don't necessarily need to press that knee to the table. We instead want to press the heel into the table and contract the back of the upper leg, the hamstrings, to begin to stabilize that knee joint again. The last exercise listed on here is patellar mobilizations that can be done by the athlete themselves or by a therapist. And it is simply moving the patella from side to side as well as up and down to break up any scar tissue and prevent that stiffening that can occur if it's just left alone. Because we do not want fluid or scar tissue to build up in that area, because then we won't be able to reestablish full range of motion. The next phase begins, of course, 2 weeks after post-op. And again, it includes those heel props. We're also going to include flexion hangs, prone hangs, stretching of the hamstrings, hip strengthening, and we're going to begin to squat. Not deep squats, but beginning to get that motion back. The goal of all of these is to regain balance and restore normal gait and walking patterns to decrease the strain, extra strain put on muscles that would not normally be engaged as much. So going into the video, I'm going to skip heel props because we saw this in the last video and go straight on to these flexion hangs. So what you're going to see is the athlete is going to be seated off the edge of the table, and he is going to use his good leg to cross over and pull his bad leg or bad knee, injured leg, into flexion. This is a way to actively engage that other leg while also passively flexing that leg. The next exercise is a prone hang, where the athlete is, of course, on their stomach in a prone position, and their low legs are hanging off the table. You can see that there is a weight attached to what would be the injured leg, and this just helps to put the leg in full extension with a little bit of push, but not enough to hurt. The next exercises are, of course, stretching. And here you'll see that the athlete is going to gently bend at the hips and stretch down towards his feet. The goal is not necessarily to touch your toes, but just to get a good stretch in those hamstrings so that they can be worked with a little better. The next exercises, or group of exercises, are hamstring strengthening exercises. And here you're going to see he's going to lay on his side and raise that leg into abduction away from the body. And then next, you'll see that he will do hip extension, where he's going to lay on his stomach and push his heel towards the ceiling while keeping his leg flexed. And finally, he will go into adduction, where he will use the bottom leg that he's laying on to push up towards the ceiling, and this strengthens the muscles on the inside of that upper leg. Last but not least, we're going to see the athlete start to squat. So these aren't big squats, these aren't deep squats, these are beginning to get that motion back. So about 40 degrees flexion at most, and no weight, of course. We will get to weight later on in the rehabilitation. The next phase, phase 3, and this is 4 to 6 weeks post-op. Again, we're going to see a lot of stretching. We're going to see that same hip circuit that I described before, but it's going to be standing. So the patient or athlete will be standing on their good leg and using their injured leg to do all of the motion that they had done before. In this section, we're going to start to see strengthening of the quadriceps through wall sits, but again, we're not going to see that deep squat. We're going to see about 40 degrees of flexion, and then we're going to see lunges, where we're starting to get a dynamic movement that engages multiple muscles at the same time. Also, at this point, we're going to start to do exercises bilaterally to prevent imbalance so that we can establish that gait pattern normally once again. The goal of all of these is to begin to strengthen and establish coordination between both legs and between the brain and body once again. So let's go ahead and go into these wall sits, since we've seen the first 2 exercises, where we're going to see the athlete put his back up against a wall, and about 6 inches is all the farther that he wants his hips to drop. It's about 40 degrees of flexion, and he holds anywhere from 30 seconds to a minute. Next, we start to see front lunges, not back lunges, to begin to engage that glute and that quad, as well as make sure that we're not seeing forward translation or movement of the tibia in this case. The next phase, phase 4, is 6 to 12 weeks post-op, and this is where we start to see advanced strengthening and coordination, especially for our athletes. So here we're going to go ahead and get into the video, and I'm going to skip the leg press since we saw that in the last one, go straight into the reverse lunges. This is something we've been avoiding because this can cause pain because it pulls on the front of the upper leg. But now we're going to start to engage multiple muscles at the same time and engaging that glute as well as the quadricep of the good and bad leg because we are training bilaterally. Next, we're going to see the one leg balance with a ball throw. And this is a way to establish balance while also establishing hand-eye coordination. So you see that he's had a couple of different sizes of balls, and not only is he passing against a wall, but somebody is throwing it to him to just increase the difficulty, but also increase the stability. So next, we're going to look at some box jumps, and the purpose of this is to, again, begin to establish that explosive movement, but also being very cautious that the ACL may not be exactly what it was before it was injured. So we want to make sure that we are stable and landing on both feet so that we can get into these sport-specific movements. Finally on the list are the skips, and this is another really good dynamic movement that doesn't necessarily need to be too stressful, but it allows for movement of the whole body to start to get some cardiorespiratory and cardiovascular help as well. You could do them backwards as they've shown here as well. So we're going to move into our 5th phase, which is 4 to 6 months post-op. And there are, again, these skips. There are lunges, both forward and backwards, moving, walking, side lunges. There are single leg balances with a ball throw again, and there are more 2-foot box jumps because we're not necessarily ready to go to those 1 foot, but we're going to get there through these 4 to 6 months. So the goal of all of these is definitely to go more sport specific. That's why we're doing the box jumps. You see these a lot in basketball players too. But we also want to start to get some agility reestablished and some comfort in moving side to side, forward, backwards, and in all of these oblique planes. But since we've already gone through all of these in videos previous to this one, I'm going to go ahead and skip this one. The final rehabilitation phase is phase 6, and this is only for our athletes. This is where we get to return to training for sports like tennis, basketball, track, and other sports. So this is between those 5 to 6 months post-op where we start to get into some really explosive training. So we saw skips before, but now we're going to start to do them sideways. We're going to get into more advanced lifting like single leg deadlifts. We're going to get more into those squats, jumps, and lunges. And we're going to do leaps and lunges now. And all of this is, again, to return to training for sports. So we're going to jump in to look at these side skips and side shuffles. So we really want to be confident on that leg, especially in tennis where we are doing this motion back and forth, forward, and sideways in all of these different directions. We want to go and see these single leg deadlifts. And we do these with weight, so again, we're training back for sports. You can see he's incorporating balance, strength, stability, all of that. We've seen some squats, jumps, and lunges. We just do them more explosively at this point. And I'm going to jump straight into these single leg leaps just so we can see how they're kind of static and dynamic because you want to leap, be confident about landing on that one leg. So this concludes all 6 phases of our rehabilitation. And just another thing to remember always is that no 2 patients or athletes are ever going to be the same. So progress is going to happen at different rates, and there may be frustration associated with it, but just keep reminding your athletes that they can't compare themselves to one another because every person is different. These are my resources for this video, and I just wanted to thank you all for watching this, and I hope that you learned something.